Good afternoon. My name is Norm Beauchamp. I'm chair of radiology in the School of Medicine. I also serve as chair of the University of Washington Faculty Senate. My area of interests include population health with an emphasis on stroke prevention and volunteerism as a means to better serve the needy. It's a privilege to introduce our speaker, and somewhat intimidating to be around some of the people that have really changed population health and had such a major impact. 1,100 children are infected with HIV each day. Where do they come from? Less than one comes from the United States, 100 come from Asia and the Pacific, and each day, 1,000 babies are infected with HIV in Africa. The prevalence of clinical depression is 1 in 5. A sense of hopelessness, shame, subjected to discrimination, 1 in 5. All aspects of their existence, earning, learning, yearning, are affected for them, their families, and communities. All too often, it goes underdiagnosed or undertreated. 6 children die every minute due to hunger, 1 every 10 seconds. Hunger is not an incurable disease. We know how to treat it, and yet it continues unabated. In 2012, nearly 13 million people died as a result of living or working in unhealthy conditions. That's equivalent to a population of Seattle being lost every 18 days. Every 18 days. Populations of individuals, mothers, sisters, brothers, babies who cannot access, afford, or envision health. It's avoidable pain and it's avoidable suffering every day and everywhere. To quote Owen Arthur, for he who has health has hope, and he who has hope has everything. To live without hope is not to live. Providing restoring hope, nothing characterizes the responsibility and the opportunity for a university. It's the essence of why we exist. It's why I'm proud to be at the University of Washington, more so than any university in the country, arguably the world. Our faculty dedicate themselves to improving health. Population health. Unfortunately, the successes are inadequate in number and pace relative to the magnitude of suffering. But it doesn't mean we should signal defeat. Rather, we should call for a new beginning. Call for a new beginning. Why do I believe that new beginning can be here? For 2 reasons. Ours is a faculty, staff, and student body whose tireless efforts demonstrate they understand the struggles. If you know the why, there's no what you cannot overcome. Second, we have the right leader at the right time to make population health a university priority. A president that will embrace the urgency to respond to those in need and the ability to mobilize the University of Washington to action. She's brought focus, energy, and impact to every role she's had: faculty chair, dean, provost, and now president. As chair of the Faculty Senate, I've witnessed firsthand her ability to prioritize issues and mobilize teams, improved access for students, prioritizing excellence for faculty, a dedication to overcome race and equity challenges, and a most extraordinary commitment to shared governance. But beyond all that, she cares deeply, and for this matter of this magnitude, her level of caring is exactly what is needed. When I think of our president, a question posed by Martin Luther King Jr. comes to mind. Life's most persistent and urgent question is, what are you doing for others? What are you doing for others? Her depth of caring, her leading by example, her ability to inspire teams, it gives me faith that the answer for the students, faculty, and staff at the University of Washington will be, we are creating health, we are returning hope. I'm proud to introduce Anna-Marie Cauce, the president of the University of Washington.
Thank you so much, Norm. That was just a lovely introduction, and really glad to see a packed room on a day that's absolutely beautiful out there. All of you, I know that you're all working hard to make the world a better place, and so really pleased you were able to make it. I want to give a shout out to our deans and to UW leadership, to our government officials, and to our global health partners who are here today. Again, I know how busy your lives are, and this is a particularly busy time. This is breakfast time and lunchtime every place, and so I really appreciate your taking the time to be here, because this talk and what we want to do together is really all about community. So today, I want you to take a moment, and I'm going to ask you to look ahead, to look towards the future. Thanks to your work and to those who came before you and will come after, we have an unprecedented opportunity to help people live longer, healthier, more productive lives here and around the world. I'd like you to join me today in imagining how the University of Washington, together with the incredible organizations and people in this region, can contribute in even greater ways to the health and well-being of our world. How we can take the next big step forward to improving people's lives by deepening our commitment to what I'm going to be referring to what we're going to be referring to as population health. But first, I want to tell you about a community. It's a community, like many others, full of people with dreams for themselves and hopes for their children, people facing all the challenges of our interconnected world, but with few of the opportunities that most of us in this room enjoy. The people of this community go off to work every day when they can find work, not always sure of how much they'll earn or whether they'll earn enough to support their families. Many women go back to work just days after giving birth, even those who are raising children alone, having lost partners to violence, drugs, disease, or incarceration. Or maybe they fled violence from war or a natural disaster that was impelled by climate change. Many in this community face discrimination because of their race or ethnicity. It presents itself in big and small ways, from whether they can earn a decent wage, whether they can find a decent place to live, or whether the local security services will stop and question them on the street. Parents in this community send their children off to work, send their children off to school. Actually, sometimes they do send their children off to work, hoping that more opportunities will be possible for them through education. But a quarter of them leave without having breakfast. And when they do have food, it's often lacking in the nutrients needed to power their growing bodies and growing minds. In this community, good food is expensive. It's also scarce. Children go to underfunded and in some cases declining schools. Dedicated teachers do their best with what resources they have. They do everything they can, as do their colleagues who work in nearby clinics, working with those who come to them with conditions that were treatable, with diseases that were treatable if they'd been covered by insurance, or if the treatment were affordable, or if they were able to afford missing work to get the treatment. The daily trials of the people in this community are largely invisible to the world, except for those times when a correspondent parachutes in to report on a tragedy, a singular event deemed more newsworthy than the day-to-day struggles of an entire community. Yet, the people in this community live in or on the outskirts of one of the world's great cities. A few miles away, gleaming skyscrapers multiply on the horizon. The city's a boom town, like others that have had the good fortune to be located on an avenue of world trade at the intersection of a new economy. In this city, it seems as if wealth and happiness are there for the taking. But for the residents of the community I was talking about, that boom town may as well be a world away. I could be describing a host of urban areas around the world where only miles away from glittering towers are people barely scraping by, out of public view. But this community's right here in King County. Within a distance of a few miles, there can be a difference in life expectancy of more than a decade. Where 2/3 of Black and Latino students go to school, where a majority of the students are from low-income families. Ours is a region of opportunity, no question. But that opportunity is too often determined not by how hard you work, but by the circumstances of your birth. We talk a lot about disruption. We don't talk enough about the disrupted. That's why our calling as a university is so important. Like so many Pacific Northwest organizations, we're the products of this beautiful land of the Coast Salish peoples, of glaciers and volcanoes, of rainforests with giant trees whose roots spread out for hundreds of feet. We too are firmly planted in this land, in this community, but our reach is global, and our aspiration is nothing less than to change the world. We're the citizens of our state and citizens of the world. We're a state university and a global university. And we have the duty to act on behalf of the local and global good because they're intertwined and inseparable. Humanity's collective yearning for a better life, not just today as we grapple with refugees seeking safety from war, but over the course of history, shows us that oceans can't divide us, that walls offer no defense against diseases that travel the globe. We have the capacity together to contribute to a healthy and productive life for all of us, whether studying or working in business or social work, international relations or medicine. Our students have an opportunity to have a tremendous impact on the world because this is the right time, and because of my partnership, because of the university's partnership with you, this is also the right place. It's important to begin by defining what we mean by health. Health is more than the absence of disease, though it is important to be absent from disease. And our university plays a crucial role discovering new treatments and cures for emerging diseases like Zika to age-old maladies like heart disease and cancer. Couple that with our work and interventions in developing countries around the world and the almost $300 million in charity care we provide here at home, and it's clear that we have a role in helping people live longer, happier lives. There's no question about our commitment to traditional health care. But there are also many conditions intertwined with physical and mental health and well-being, from nutrition and education, to the quality of the air we breathe, to the range of factors that are involved in social and environmental equity. There are many ways one can fall or be pushed into poverty, but there are also many ways to help people out of it, from providing access to better education and economic opportunities, to building more effective societal infrastructures, better governance systems, by identifying and addressing the causes and impacts of a broad range of health indicators for populations of people, from neighborhoods to countries. We have an opportunity to really impact health and well-being in profound ways, here and around the globe. We have the opportunity to improve the population health of the world. Now, the great news is the UW and many of you, our regional partners, have built the capacity to truly utilize knowledge in more powerful ways than we've ever imagined. And so what I'm calling for today is not for us to build something new from scratch. It's really a strengthening of our combined efforts, a commitment to create a shared vision to be implemented in shared partnership over the next quarter century or so, in service to the people that we serve locally and globally. This can and should be a defining priority for our university, for the Puget Sound region, and for our state. Now, I've come to this place after having spent most of last year looking at the university from kind of a unique angle. I've been there for 30 years, and I thought I knew every corner of the place. But as president, you get this kind of broader view one that's enabling me to see many opportunities that exist for us to connect, to weave together what can seem like very different fields of study and research. Being president means you get invited to more places than you do as provost or as a member of the faculty. Sorry, guys. I've had the incredible opportunity to learn about the work of the Roadmap Project in South King County, to meet with tribal leaders at Lummi Nation, healthcare leaders in Spokane, and to see, or rather to breathe firsthand, the effects of pollution in China. These experiences and my conversations with many of you and with many of our global neighbors have given me a deeper understanding of the role that the university already plays, but also of the additional role it can play in contributing to the health and well-being of our world. We are the leading public university in the country for sponsored research. We have one of the largest, most comprehensive biomedical research programs in the world. Given our size and breadth, 3 campuses, over 50,000 students, over 5,000 faculty, we have impact on a pretty massive scale. And our impact is focused on the public good. Our commitment to innovation in every corner of the university means we're not only willing, but we're eager to pursue new lines of inquiry. We're undaunted by the risk of failure, because that's how we hone in on success. And we know the tremendous good that will come when we succeed. Our location in the Puget Sound amplifies our impact on population health. We link arms with more than 130 organizations working on population and global health, from the Gates Foundation and PATH and the Washington Global Health Alliance to organizations that might focus on an individual country or on a specific malady. There really are few places on earth with more opportunities for collaboration and collective impact than we have right here. And we'll need your guidance and commitment as we shape this vision. What's more, our region's role as a global health for computing and information technology, it may not seem like it today, but we really do own the cloud, means that we have here at our disposal more talent and computing power than ever before has been assembled in one place. Through big data research, patterns that once seemed invisible can now be studied, enabling us to identify the root cause of problems and to measure the success of health interventions and ultimately preventive measures. Through the application of technology that we have at our fingertips, we have the ability to not only diagnose individuals, but entire cities and even nations. We know what ails us, our communities and our planet, and we can put that information into better practices so that we can do something about it. As a university, we have the ability, we have the responsibility to contribute to the public discourse about the best ways to solve the health challenges of our time. As scholars, we test hypotheses. We engage in deep and rigorous analysis. We follow the evidence wherever it leads. And oftentimes, that's someplace unexpected. Sometimes we unearth data that's controversial. But at a time when policy debates too often seem fact-free, we present our work to policymakers and the public so they can make informed decisions. That role isn't always easy. Challenging conventional wisdom and entrenched interests rarely is, but it's vital if we are to create inclusive, democratic societies. People throughout our community and our world see the benefits of our collaborative, interdisciplinary, data-driven approach. It's an approach that from the start has emerged out of partnership with so many of the people in this room. And so I'm going to share just a few of what could be many, many, many powerful examples. And I know some of you will be saying you didn't mention this, and that's a good thing, because we have many more that I could talk about. One example is the university's Institute for Health Metrics and Evaluation. It was launched 9 years ago with the support from the Bill and Melinda Gates Foundation. It's presenting leaders and policymakers what amounts to a diagnosis for their nations. And those leaders are responding with enthusiasm. Data from IHME led the Ministry of Health in Rwanda to create a program to deliver modern, cleaner burning stove to 100 million homes. In the world's most populous nations, including China and India, policymakers are now using UW data to guide their decisions about reducing air pollution. And perhaps most significantly, the National Institutes of Health is now using IHME data as one of its criteria for deciding where to fund research. Okay, that's $30 billion in annual research funding distributed to improve the health of the world, and their decisions about where it goes is informed by UW data. How cool is that? UW Medicine has 26,000 employees and 5,000 students and trainees here and throughout the world, focused on a single mission: to improve the health of populations. In line with our public mission, this work is done in concert with local government. We run the county's trauma center, and we're among the first to become an accountable care provider to a local company. Together with faculty across the health sciences and our collaborators throughout this extended region, we're creating the next generation of health professionals, treating thousands of patients, leading in social work and public health interventions. I'm particularly pleased about our expanding collaborations to accelerate the pace of curing and preventing cancer within the Seattle Cancer Care Alliance. I'm also very excited about our new partnership in medical education with Gonzaga University in Spokane as we focus on the needs of communities in Eastern Washington. And this year, we have the largest freshman class ever in that program. Again, pretty cool. The Department of Global Health is a crucial collaborator and leader in this worldwide mission. They have active projects in 138 countries. One of those projects uses modern technology, text messaging, to address an age-old concern of new and expectant mothers. How can I best care for my baby? Led by Dr. Jennifer Unger, who's also an OBGYN, the project shows that giving new mothers in Kenya the ability to ask questions of health professionals through two-way text messaging decreases infant mortality. Texting saving lives. That's really remarkable, but public health reminder, not while driving. In another groundbreaking effort, researchers from the School of Public Health and the Hutch Cancer Research Center led the largest study of its kind into disparities in breast cancer treatment and diagnosis. What they found confirms the shameful existence of inequity in detection and treatment. Women of color were up to 4 times more likely to be diagnosed with cancer in its late stages, and they were at much higher risk of not receiving the recommended treatment at all. The University of Washington Jackson School Center for Human Rights, they're drawing attention to the direct connections between the management of our natural resources and the welfare of communities who depend on those resources. The resource curse is a well-known phenomenon. Because of the hunt for natural resources that drives our world economy, millions of people around the world are exploited and their health and well-being threatened. Their lands are deforested or simply taken, their water polluted, their communities forever altered, at least until we develop scalable, sustainable alternatives. The Puget Sound Institute, part of University of Washington Tacoma's Center for Urban Waters, is developing indicators to help us better understand the relationship between habitat restoration and well-being. And knowing that our urban centers are our greatest challenge and our greatest opportunity, Urban at UW brings together faculty from all 3 campuses to build inclusive innovation collaborations focused on improving health in urban areas around the globe. Similarly, the West Coast Poverty Center is taking a cross-disciplinary approach, uniting anti-poverty research, practice, and policy by forging connections between scholars, policymakers, and practitioners. For example, Professor Vicki Lawson, director of the Honors Program and the Relational Poverty Network, and her students, please raise your hands. Thank you so much for being here. And they have permission from their instructors, just to be clear. They're studying how poverty is produced and addressed by economic, political, and cultural relationships between social groups. Many different factors beyond economics conspire to force families into poverty and to keep them there. From the healthcare system, to climate impacts, to the criminal justice system, to discrimination in housing. And we need a holistic approach. It's not only beneficial, it's vital if we're to strive towards social justice. We really need to look holistically. Improving well-being also means ensuring that our individual actions and those of our institutions continue to combat the effects of racism and inequity. Through our Race and Equity Initiative, we're taking up this challenge, and I'm inspired by the work happening across our campuses, particularly amongst our students. And speaking of our students, I'd ask you to check out Skies Over Seattle. There are 3 student-generated performances that have evolved over a year of collaboration and conversation with 3 U-District community groups. The arts and humanities have a way of breaking down barriers in ways that sometimes other interactions can't. You can learn from our students' experiences and support them on stage during the world premiere next month. So be there or be square. It's going to be fun. Our students are the leaders, innovators, change makers who will shape the health of the world. And they aren't waiting until graduation to make a difference. Dentistry students regularly serve patients in rural and underserved communities. Our global medicines program pharmacy students take part in medical brigades. And students in law and political science work on human rights and labor issues in Central and South America. We are #1 in the world in Peace Corps volunteers. And the University of Puget Sound and our new partner Gonzaga jointly hold the #1 spot for small schools that produce Peace Corps volunteers. That tells you something about the special culture we have here. In every one of our university schools and colleges, students are working alongside faculty and advocates and community leaders to improve health and well-being, always learning, sometimes teaching, and always inspiring us with their drive and their passion. Our work is better because of the questions they raise and the barriers they've inspired us to break, starting with the barriers between disciplines. So many of our students, in ways big and small, are leaders. And as they've led, they've done so with conviction. Sometimes they need to raise their voices to be heard, and I applaud their courage. Other times, the change they make is quiet, behind the scenes, sometimes behind the screens, but every bit as meaningful. As we look to the future and develop the renewed vision for our work, the student experience will be at the center. All right, so where do we go from here? I've shared a few examples of our commitment and the progress we're making, yet the challenges we face are pretty daunting. No one university, educational, or healthcare institution in the world, and no region in the world is better poised to lead us toward solutions, though, than the University of Washington, right here in the Puget Sound in the state of Washington, in part because of you. And so it's time to renew our vision together. Over the next quarter century, we'll expand our ability to turn health evidence to use the ability to diagnose patients' populations and the planet into actionable policies, reforms, interventions, innovations. We'll enlist all our UW campuses, colleges, schools, and units, those that are already driven by a mandate to improve population health, and those that can contribute in ways that are less obvious, but just as important to this effort. So here's where we begin. We start by doubling down on our commitment to reducing health disparities here and around the globe. There's no reason that your place of birth should determine the likely due date of your death, or that your race or ethnicity should predestine you to greater suffering. It continues with a determination to increase global security by tackling the challenge of environmental sustainability. It's too late to stave off some of the effects of climate change, so we also have to study ways to improve resilience, especially in those communities that are most harmed. Those impacted by climate change are many of the same communities that are stricken by poverty, which is why we also have to strive to address the social, economic, and environmental inequities, because they often go hand in hand around the world and here at home. We're going to inspire the next generation of decision makers who will drive evidence-based health policy, guided by the strong conviction that every life has equal worth. We'll create new paths for our students to work that positively impacts population health, building synergies within the wide range of disciplines that can contribute to this mission. And we, of course, want these students to learn from the world's most outstanding faculty. So we're going to have to add to the global leaders who already call the UW home. Together, they'll team up with leaders and collaborators from the community who have the most to gain from the democratization of health evidence, because it unlocks the power of data for the benefit of all. We have in our pockets more computing power than could have ever been imagined. So let's encourage people to use it for something more than Snapchat or Tinder. The UW has excellent world-class programs in every school and college. The Puget Sound region in our state have some of the most innovative public and private organizations in the nation, as well as progressive local governments that are excellent partners. We have all the parts necessary to create the change we want to see in the world. The challenge is, how do we make sure that the sum of the parts equal more than the sum of the parts? This initiative is all about making sure that the whole is greater than the sum of the parts. It's about catalysis and fusion across the full continuum of innovation and disciplines, from neighborhood to transnational programs, from anthropology to aeronautics, devoting our best talent and sharpest minds to finding solutions to these challenges. And that's no small mandate. There's much to be done. I know that money is finite. So we have to work with individuals, communities, governments, philanthropists to determine the most cost-effective and productive uses of public health and social service resources. We will engage with them. We will engage with you in both the formation of this vision and its implementation over many years. This is a years-long initiative and struggle. That's the only way to have the greatest possible impact, to save and enhance the most lives, and to build better, smarter, safer communities. We begin by engaging the entire community in the development of this initiative. A team of leaders from across the university have already been putting ideas together, but we're going to bring more voices to the table. Even as we look at the range of actions that we could take, including the possibility of new degrees in population health and ways to encourage more students to investigate population health-related questions, regardless of their major area of study. We're going to need more guidance from a broad range of faculty and from our community and governmental partners. We have the beginnings of a vision. We need all of you to really shape it going forward. Within the next 2 weeks, I'm going to appoint a Population Health Leadership Council to begin this work and to develop a long-range, university-wide plan. The council, which I'll chair, will consist of deans in the health sciences and from engaged colleges and schools, like arts and sciences, College of the Environment, engineering, education, public policy, and law, as well as faculty and staff representing important contributing programs and stakeholder units on all 3 campuses. It'll begin by taking an inventory of existing programs, opportunities, and partnerships related to population health. I fully expect that after this talk, I'm going to get a bunch of emails about the important initiatives and programs that I failed to mention. And that's a good thing. The inventory will be followed by a launch of a university-wide visioning effort this fall. I'll ask the council to develop recommendations for phase 1 by January 2017, with a full 25-year vision and action plan to follow. An external advisory board with representatives from our regional and world partners will also ensure that we leverage our collective efforts to the greatest possible good. And we're going to consult closely with our faculty and student government to evaluate our progress, our priorities, and to make sure we align with the imperatives of diversity, equity, and inclusivity. The implementation plan that we develop together will be part of our larger strategic planning, ensuring it's a priority for resource allocation and for program development. Additionally, securing the resources needed for this effort will be a priority for the campaign, which we'll be launching in October, as well as being a priority when we meet with policymakers in Olympia and in Washington, D.C. And for those of you that worry about that kind of thing, it won't detract from the importance of what you're doing within your unit, because we all have something to contribute to this effort. To get this right is going to require deep reflection and analysis. It'll require flexibility and openness to changing course when needed. But at the same time, it needs a sense of urgency and a determination to succeed. Some resources are limited, but our spirit is boundless. And we have so many partners and potential partners around the state, so many experts in allied fields, and everything from cancer research to data visualization, from transportation and logistics to personalized customer experience. Expertise vital to doing work globally, but on a personal scale. Just feel the unique potential that exists right here in this room. The University of Washington, the Puget Sound region, and our state can lead the world in improving population health. And it's time for us to take up that mantle together. Now, I started my comments today talking about a community, and I'm going to close by talking about a person. She was born into a comfortable life, though that comfort was soon shattered by political upheaval. She and her family had to flee their country, and the comfort they'd experienced was lost in a moment when they became refugees. Her highly educated parents worked in shoe factories to support the family. Though they had little money, what they did have was optimism and a belief that education was the key to a better life. She and her family had the good fortune to come to this country at a time when the divide between the rich and poor was narrowing, not widening, and when higher education was more attainable. Went to college with the help of scholarships, found mentors and a calling. Of course, the girl who came to this new land was me. And despite some considerable obstacles, I'll never forget the sacrifices my parents made. I also have to acknowledge my privilege, the opportunities I was given, the good fortune I've had, which far exceeds the opportunities available today to billions of people around the world and to millions of people right here at home. Opportunities to live truly healthy lives enabling them to reach their full potential, to contribute to society, a society that needs all our talents to move forward. That's what drives me and our university. It's what inspires us, faculty, staff, students, at the UW and amongst our partners. That's why I'm calling upon you to join me. That's why I'm calling on all of us to use our collective talents to improve the health and well-being of people. Some we'll never meet, some we pass every day on the street, some in our own families. Because I know that if we come together as scholars, as leaders, as innovators, and as human beings, grateful for the chances we've been given, we can truly create a world of good. Thank you, and onward.
Thank you. Very good. That was absolutely terrific. Thank you.
Now
Bill-
the work begins.
Now the work begins is exactly right. Mission, vision, tactics, initiative, urgency, inspiration. Thank you. How do we keep it going? The good news is we can keep it going right outside of this room. We're going to have a chance to meet with all these great leaders from the community and the UW and talk more about what are we doing, where are we headed, building on the great talk we just received. So thank you again, Anna Mari, and all of you for being here.